In this Medicoapps Masterclass, we will learn about stages of sleep. Now, we know sleep, there are two main stages of sleep, that is non-rapid eye movement sleep and rapid eye movement sleep, also called as NREM sleep or REM sleep. So, these are the two important stages of sleep. In non-rapid eye movement sleep, we have got four stages, that is stage 1, stage 2, stage 3 and stage 4. And let us look at each one of the salient feature of each one of these stages. Stage 1 is easily arousable, and the main difference from wakefulness is that in stage 1 loss of alpha waves happen and there is a predominant of theta waves. So, this is wakefulness where we see a lot of alpha waves, right, and this is NREM first stage where we start having theta waves. The main difference between alpha and theta waves is the frequency of the wave. Then we have got stage 2. Stage 2 is the maximum duration of the entire sleep cycle. You have to remember that. So, NREM, the duration is much more than REM. Almost for sleep, 80% of the sleep is NREM and only 20% is REM sleep. Even in NREM, stage 2 has the maximum duration. Also, in this there are two very important feature. One is sleep spindles. Here what happens? So, these are sleep spindles. So, burst of 13 to 50 microvolt waves, and then there is a K complex, that is intermittent high voltage waves. These are K complex, these are sleep spindles. Then we have got in stage 3 similar to stage 2, but only thing is delta waves starts appearing. What is delta wave? This is mostly seen in NREM stage 4, and these are very low frequency high voltage waves. These are delta waves. So, delta waves will start appearing in stage 3, but mostly the feature of stage 2 and stage 3 will remain same when we see EEG. Also important in stage 4 is that pulsatile release of growth hormone and gonadotrophins take place. The blood pressure, heart rate and respiratory rate, all three comes down in stage 4 of NREM sleep. This is very important, and this is very opposite to what happens in non-rapid eye movement sleep. Let us move to the next slide and see what are the features of rapid eye movement sleep. In rapid eye movement sleep, this is also called as paradoxical sleep, because even though, so this is the EEG for REM. So, even though it is very similar to awake kind of EEG, but the patient is very difficult, or the person is very difficult to arouse. Here there is a beta activity with alpha waves. Okay, rapid eye movements happen, and but there is a generalized loss of muscle tone. So, the body is completely, there is a loss of muscle tone in that. Rate of metabolism in the brain is very increased in rapid eye movement sleep. Also, there is penile erections and autonomic hyperactivity like increased pulse rate, increased respiratory rate or blood pressure. Dreams seen in REM sleep can be recalled, another very important point. And what happens is they have a characteristic pontogeniticular occipital spikes, which means from pontine to lateral geniculate body to occipital centers we have got this spike waves. So, these are very important features about rapid eye movement sleep. Let us look at some other salient features of EEG rhythm in sleep is first, let us understand the various waves. If we see, there are 4 different kind of wave: alpha wave, beta wave, theta wave and delta wave. Frequency for alpha wave is 8 to 12, beta is 14 to 30, theta is 4 to 7 and delta is 1 to 4. So, beta wave is having higher frequency than alpha wave, and then theta is having lower, and delta is the lowest frequency wave. Okay. Then when we come to amplitude, so amplitude alpha wave is 50 to 100, beta is 5 to 10, theta is 10 and delta is the highest amplitude wave, which is delta 20 to 200. So, this is the highest amplitude, this is the second highest, and these two are similar. Okay. So, this is in terms of amplitude. Let us look at the salient feature. Alpha waves is maximally in occipital or parieto-occipital range, and this generally is seen in when awake stage or in resting stage when the eye is closed, but the mind is wandering. Beta waves is maximally seen in frontal area, and this happens when the person is awake and has a focused attention. Theta wave is seen in parietal and temporal region and also seen in early sleep, whereas delta wave is seen in thalamus and cortex, and this is a deep sleep wave where hormones are released. Finally, understand what are the time spent in various stages of sleep. So, in 8 hours of sleep, almost 80%, that is 6 to 6.5 hours is spent in NREM, and less than 20% time is spent in REM sleep. Most of the stage 4 NREM sleeps occur in first one third of the sleep, whereas most of the REM sleep occurs in the last one third of the sleep. Also, REM sleeps occur every 90 to 100 minutes. So, we have a cycle of around 4 to 5 REM sleeps in the entire night. With NREM, maximum time spent is in stage 2 of NREM sleep.